Welcome, and thank you for listening to our presentation. Myself, Catherine Timmermans, and my colleague Luctkar-Flude will present about planning for equity through integrating flexibility and choice into virtual simulation assessments.
We acknowledge and respect that we are presenting from the traditional lands of the Anishinaabe people of Turtle Island and proudly recognize our local host, the Atikna-Mishning Anishinaabeg. We also recognize the contributions of the Wahnapitae First Nations and the Métis Nation of Ontario.
Today we will review examples of how open access simulations can be used to reimagine how we teach nursing concepts to students, including the elements of universal design for learning to promote equity in assessments. Using simulation in nursing is really an essential tool that can help students and even practicing nurses to develop their clinical skills in a safer, psychologically safer environment by developing knowledge of the complex scenarios that they might encounter in real life. According to NACSL standards, there are many types of simulation, including various varieties of in-person and virtual simulations. Using virtual simulations and embedding them within a nursing course really does offer an interactive way for students to learn about clinical scenarios before they actually encounter them in their practice settings. They can be embedded within a course in a number of different ways, such as preparation before class, labs, and clinical, and even as a make-up option for lab or missed clinical time.
When designing these assignments, we considered NACSL standards, which identifies that there are important phases in simulation-based learning activities. That includes the pre-briefing or preparation stage, the stage where they complete the virtual simulation, as well as debriefing, which, according to the literature, is where a lot of the learning occurs. When designing our simulation debriefing, we took into account lessons learned from the Facilitator Guide to Virtual Debriefing, which we completed through CanSim. And we took ideas from that training to see what we thought would work in our context.
The CanSim virtual simulation games really are designed to enhance and engage student learning by way of actually incorporating video clips of scenarios from the perspective of the nurse, and then the student can have that opportunity to select the correct nursing action according to the learning outcome. Universal Design for Learning is a framework that really aims to create that inclusive learning environment for all learners. And we incorporated the principles of Universal Design for Learning in that we really wanted to reduce the amount of barriers that students might face when they're submitting an assignment. We allowed for options in terms of multiple formats in which they could submit their virtual debriefing assessments, so they could submit it in a written, visual, or an auditory format, for example.
Due to resource limitations, we weren't necessarily able to do what the evidence suggests as best practices in order to facilitate debriefing, but we felt very strongly that equity was really important. Some creative ideas to integrate equity into nursing assessments involve other strategies to give students fair and equal opportunity to demonstrate their knowledge and skills. Things like using a variety of assessment methods, trying to make sure that our assignment expectations are clear and the criteria are clear, providing accommodations as needed for students, and avoiding bias in assessment. We also heavily relied on encouraging self-reflection and self-assessment.
In the fall of 2022, I was teaching a med-surg and mental health nursing course, and we decided to embed some open access virtual simulations and create a simulation debrief assignment similar to what Laura had created in her course. Prior to completing the actual open access virtual simulation, we provided students with some information and some preparation reading and pre-briefing instructions. Then students completed the virtual simulation. They uploaded their certificate of completion. Following that, a short asynchronous debrief questionnaire was completed, which helped to really inform the submission of their final reflection, which was done in a format of their choice. And we were flexible in terms of when they were allowed to submit their final reflections. It could be based on the suggested date or a final submission deadline.
Over the 3 years that I've been doing this assessment, it's been very similar to what Catherine has done, with the addition of co-creation of course expectations and large group debriefing.
The pre-briefing phase of simulation is important and consists of all the activities that you want the learner to complete to set the stage for that successful simulated experience. In both courses, we gave clear instructions and a walkthrough on how to prepare for the virtual simulation assignment. It was challenging at times because we didn't often have the class time to complete the pre-briefing, so we did offer multiple ways to present the information for the pre-brief.
Flexible deadlines are things that have been used in a variety of settings where there's a suggested date, and then if people need it, they can take advantage of a 1-week extension in our case. These automatic extensions don't require students to send an email to require an extension. Some of the challenges that we've experienced with this is that students get confused. In most cases, they've been confused about the added flexibility, but sometimes students also misinterpret it as the extended deadline is the quote-unquote real deadline. I've also experienced some external judgment from others who think that deadlines are really important in academia. And when students do misinterpret the intent of the deadlines, it can be challenging to balance all the marking if it all comes in at the end.
In a moment, I will be sharing artwork submitted by a student with their permission that could be triggering for persons impacted by oppression or mental health challenges. So in both courses, students were to complete an asynchronous debrief reflection, and they had options that were included as part of that debrief. We really encourage students to be as creative in terms of the format that they chose, and we included some examples that they could draw on in order to complete their assignment. We wanted there to be depth within that submission, and we did allow for students to resubmit if they wanted to.
Using individual reflections to inform large group debriefing was very enriching for having a guided debrief that I felt was valuable. The grading of the initial reflections was quick because this expectation was set in advance with students, and general feedback was provided in the large group, which then led to further in-depth discussion. Themes were shared in a Google document to promote large group debriefing, but no individual information was shared in those documents.
Offering options and submission choices really resulted, I think, in a more equitable process for students. It really allowed them to express their experiences in a diverse and creative way. And I think they gained more understanding of what the experience was like. I think it's important to recognize sometimes, though, if you offer too much choice, it can be difficult for students and also challenging in the evaluative process when you are going to mark the assignments. So one of the ways in which we tried to reduce some of this was to make sure that we had a clear guideline and rubric to evaluate different types of submissions to ensure that, they're all held to the same quality of standard that we would expect.
If you're trying to plan an assignment like this, it's important to put some thought into the wording of your rubric or marking guide so it's not specific to one type of assignment, like a video or something that is written. We've found that basing it on Bloom's taxonomy has been a useful approach because that can be applied to a variety of formats. It's also a good idea if you're trying to promote creativity and allow flexibility, not to be overly prescriptive in what you tell students that needs to be done, while at the same time setting some benchmarks for success. We've personally found that marking guides are a little bit more flexible than rubrics, and we've had some success with allowing resubmissions when it's feasible. It's not always feasible to do that. Feedback is really important for learners to improve. That feedback could happen on a rubric or marking guide or in general comments to the class. What's important is that learners are able to identify how to improve moving forward. As we've mentioned throughout the presentation, there have been a number of benefits for students and faculty to taking this approach to integrating virtual simulations in our courses. We hope to continue improving our approaches. It really is a balance between accessibility and our own work-life boundaries. So if you're thinking about getting started, maybe start small, try one thing at a time, and then decide what works best in your context. We know that our assignment design isn't perfect, and we're continually trying to improve within the lens of a trauma-informed approach to education. We'll continue to use different options for debriefing and try to balance all of the other considerations that we've talked about throughout the presentation, recognizing that each group of learners is unique and what works for one group might not always work the same for everyone. If you have any questions or comments, please reach out and connect with us.